What I'd like to talk about is osteoporosis and the resulting pain from compression fractures. Osteoporosis is an epidemic. We see in the United States many millions of people who develop osteoporosis and a weakening of the structure of the bone. And in that setting, there is a possibility of fractures of the weight-bearing aspects of the vertebral body. These are called vertebral compression fractures. There's about 700,000 fractures that occur annually in the United States, resulting in significant pain and morbidity. These are generally patients over the age of 50 or 60 years old, developed osteoporosis, and can cause a fracture, even just minimal activity, just bending over to pick up your dog or the newspaper, and you have severe pain. Generally, the pain is in the spine, at the level of the fracture. So in the lumbar spine, the low back, you'll have pain in the low back. Within the thoracic spine, you might get pain between your shoulder blades. This pain is typically worse with weight bearing or bending or twisting motions. Some of the pain may not be very severe, and we can treat that conservatively with just time. They may heal on their own in about 6 to 8 weeks. In other patients, the fracture is severe and the pain is debilitating and they're unable to stand and walk. And those patients who have severe pain, we have a new procedure that's recently become available. It's called Kyphoplasty, or balloon kyphoplasty, where we take a vertebral body that is fractured. If we say this is the one that has fractured, we can access the main weight-bearing part of the vertebral body through a bone that there's no nerves or blood vessels in, and it's safe to access. And we put a special needle that goes into the vertebral body. And once we're inside the vertebral body, we place a balloon through the needle and expand the balloon to create a cavity inside the vertebral body. And when there's a compression fracture, typically there's a loss of the height. And with the balloon, when it's expanded, can restore the height of the vertebral body, make the cavity, and the balloon is withdrawn, and then orthopedic glue material is then injected through the needle and will stabilize the fracture, essentially producing a cast on the inside of the vertebral body to relieve the pain. And here's a clear plastic model. If I can see if the fracture is in this area, that when the balloon is inflated, it produces these two cavities, and then the cavities are filled with the glue, which is a white material, and it'll set the fracture from the inside. And this is a minimally invasive procedure. There's no incision, it's just placement of the needle. It's outpatient, can be done. It takes less than an hour. It's done with monitored anesthesia care, or what's called twilight sleep. Doesn't require general anesthesia. And patients lay for about an hour after the procedure, so allow the cement to set. Once it's set, the pain is generally relieved, and the patient's able to stand and walk and leave the center. This is Dr. Betts again. I want to thank you for taking the time to watch this video. I hope you learned some interesting aspects of what we offer here, and we look forward to seeing you again soon. Thank you.